Purposeful Hourly Rounding by Andrea Ochoa at Touro University, California. The problem. Currently, patient satisfaction is the key metric that influences hospital ratings and patient services reimbursements. The Hospital Consumer Assessment of Healthcare Providers and Systems, HCAHPS, survey is the tool used to evaluate patient satisfaction. Nursing responsiveness is an important factor in patient satisfaction, which reflects in the HCAHPS survey and therefore is an important factor in reimbursement. The purpose. Purposeful hourly rounding has been suggested as the primary mechanism to address patient basic needs, improve safety, and enhance patients' experience. Purposeful hourly rounding can improve patient outcomes as well as improve facility ratings and increase reimbursement. The significance. In a 2006 study by the Alliance for Healthcare Research, 27 nursing units in 14 different hospitals nationwide piloted hourly rounding. As you can see from the chart, outcomes included vast improvements in patient satisfaction and reduction in pressure ulcers, call-out usage, and patients' falls. These patient safety improvements also translated into a significant reduction in hospital costs. This is particularly relevant after the Never Events legislation went into effect. As of October 1, 2008, Medicare and Medicaid no longer reimburse hospitals for what they call reasonably preventable errors, including patient falls and third and fourth stage pressure ulcers. Individual studies. Study by Mitchell, Levering, Trotta, and Ushmaid in 2014. Their findings. Hourly rounding improves patient perception of nursing staff responsiveness. It also reduces patients' falls and call-out use, and improves patient satisfaction scores. Their recommendations. Nurse executives are urged to support hourly roundings within their institutions. Sustaining hourly rounding places a considerable strain on nursing resources, but it definitely has a positive impact on patient satisfaction scores. A study by Odias on 2015. His findings. Consistent, purposeful hourly rounding can increase patient satisfaction scores, improve pain management, decrease the number of call-outs and falls. His recommendations. Designation of unit champions for each shift who can support frontline staff in order to sustain hourly rounding. A study by McLeod and Tesselef, 2015. Their findings. It is not enough to just write a new policy and documentation process. To succeed, the change process must involve staff, not just leaders. Rounding requires a change in the work staff, not leaders. Their recommendations involve the frontline staff. Do it with staff, not to staff. Validation rounding by leaders should be also implemented. Use technology to assist the new workflow. Peacock question. In nurses and patient care technicians on the 5 West Medical Surgical Oncology Unit, can in-services and coaching on importance of purposeful hourly rounding increase HCAHPS scores to 90% in the areas of staff responsiveness and pain management from the second quarter to the third quarter, HCAHPS scores from 2018. Operational definition. Definition of purposeful hourly rounding. According to the American Nurse Today, purposeful early rounding is a proactive, systematic, nurse-driven, evidence-based interpretation that helps us anticipate and address patient needs. Definition of HCAHPS scores. The Hospital Consumer Assessment of Healthcare Providers and Systems is a patient satisfaction survey required by the Centers for Medicare and Medicaid Services for all hospitals in the United States. In the Theory of Planned Behavior by Ashton, behavioral intent is the key component. This theory predicts that behavioral intentions are influenced by three types of beliefs. Number 1, the attitude towards the behavior. Number 2, subjective forms. Number 3, perceived behavior control. These beliefs influence the intention, which is the attitude, and ability, which is the behavioral control of a person to perform particular behavior. In this case, the behavior is purposeful early rounding. The human subject's concerns. Privacy. The population involved in this study are registered nurses and patient care technicians on the Medical Surgical Oncology Unit. Anonymous pre-intervention surveys were completed to assess for the unit barriers for purposeful early roundings. Anonymous surveys approach was taken to allow the care providers to express freely without having any concerns of repercussions. Nursing implications. Purposeful early rounding is a nurse-driven, evidence-based intervention that focuses on patient care. Integration of purposeful early rounding should be implemented to the daily nursing workflow. It promotes patient safety, improves the patient care experience, and most of all, provides efficient patient care. Stakeholders. Director of Adult Services and Students Preceptor. Care Experience Practice Leader. 5 West Unit Manager. Clinical Nurse Educator. Assistant Nurse Managers. Registered Nurses, and patient care technicians.